Good evening, Democrats. You know what time it is. It's time for Prop Talk. And tonight we'll be talking about yes on Prop 29. Before we begin, I want you to help us spread the word. There is a link that's going to go in the chat. If you click on the link, you can choose to share on Facebook or share on Twitter to spread the word on your socials. So if you take a second to click that link and then click share on Facebook or share on Twitter to bring more of your friends to learn about why they should vote yes on Prop 29. You can also just copy and paste the link into a text and send it to your friend directly. They can get on as well. So let's see how many more folks we can get to join us. Once you've invited someone, please let us know by saying, yes, we can in the chat box. Also, let us know where you're joining us from so we know who's in the room. All right, so my name is Vincent Jones. I'm training director and senior advisor for the party, and I will be your moderator this evening once again. We're joined by two great folks who will be helping us to learn more about Prop 29. First, I want to introduce David Miller. David Miller is the research director for SEIU, SEIU United Healthcare Workers West. So David, welcome. Oh, I think you're still muted.
Hello. Hey,
there we go. We also have a dialysis patient who will really be able to give us a personal perspective on the issue. Carmen Cartagena from Concord, California. Hi, Carmen. Oh, you're muted too.
Hi, Vincent. Thank you for having me.
Thanks for being here. Okay, before we get into the nitty-gritty of the initiative, Carmen, I would love for you to explain to our audience what dialysis is.
Okay. Dialysis is a treatment that cleans your blood as a substitute for the kidneys. So on the technical aspect, they drain your blood, it cleans through a machine, and then it comes back into your body.
And who would need that, that treatment?
Anybody with kidney failure.
Okay. And this is probably for either of you, Carmen or David. How many people are on dialysis at any given time in California?
It's roughly 80,000 folks, and it's millions of treatments a year because people get it 3 times a week, 52 weeks a year. So it's 80,000 folks, and it's millions of treatments.
And how many dialysis centers are there in California approximately?
There's about 600.
That's a lot. Okay. And are they located in any particular part of the state or types of communities?
I mean, you'll find them all over the place. You'll find them in really diverse communities, urban areas, rural areas. They're scattered throughout California and have a wide distribution.
Okay. And I'm curious if anyone in the audience who's watching is on dialysis or cares for someone who's on dialysis. I'd love for you to share so you'll know if we have that experience in our room too. Just say, just let us know in the chat if you are. Okay, so I want to get into the initiative. Maybe Carmen, can you start by really sharing from a patient perspective, what would change for you if Prop 29 were to pass?
Okay, well, right now, my clinic and other clinics are running short-staffed. So let's say on any given day, there are 12 to 15 patients per session, and they will have 2 technicians and 1 nurse, or 2 technicians and 2 nurses. But more often than not, it will be 1 nurse and 2 technicians. And at any given time, you will have both the nurse and the technician off the floor, only leaving 1 technician to take care of the 12 to 15 patients. So having a physician on staff would ensure patient safety, because anything can happen while you're on dialysis. We can bleed out, we can pass out, we can also succumb to sudden cardiac death, to fistula rupture and infiltration, and other symptoms that would affect our health and our well-being and could affect our life, actually. So it's crucial that they are either, that they not just either, they need to be fully staffed, but they also need to have a physician on staff to make sure that we're taken care of. Because, I'm sorry, go ahead.
No, you go ahead.
I was going to say, those are very daunting. I don't know. They're just a really bad situation that can cause you death. I myself have experienced the bleeding out, and I have witnessed other patients bleeding out. I wanted to show a picture of me when I bled out recently, but was told it would be a little bit too graphic. So if it's too graphic to show, imagine what it is like actually experiencing that, or watching somebody else going through the same thing, or watching somebody pass out on the chair, which is, again, something I have experienced. It's very frightening. And sometimes by the time you get to the hospital, it's a little bit too late for some patients.
Yeah. Thank you, Carmen. David, would you add to that? Well, how would Prop 29 change care if it was passed?
Yeah, the heart and soul of the proposition is really adding a doctor, a nurse practitioner, a physician assistant, while dialysis is being delivered in the clinic. Like it adds an extra caregiver who's responsible for quality of care. And if you walk away with one memory from this call, that's it. That this is really what this proposition does. It improves care by putting a physician or advanced practitioner in the clinic to help supervise and help provide care that's desperately needed. So that's the major provision of the ballot measure. It also does a few other things. There's some perverse incentives inside dialysis around who gets treatment. So we put in a non-discrimination clause. So no matter what type of insurance you have or no insurance, whether you're Medicaid, uninsured, commercially insured, Medicare, the clinic has to treat you the same, because currently right now they really gouge people with employer-based insurance, and it creates a lot of perverse incentives for the dialysis clinics to see those folks, other folks. We also have infection reporting that we're going to add and consolidate, so it'll be easier for patients to get a hold of the infection rates at their clinics. And really importantly, we're going to regulate whether a clinic can close or not. Currently, dialysis clinics close with no regulations. And so we're going to put in a set of regulations where they actually have to go to the Department of Public Health and ask for permission to close. And we think this is really important change as well. And then we're also going to require that the clinics who frequently, the physicians who own the clinics are in partnership with publicly traded companies that are traded on the New York Stock Exchange. And we want them to disclose those ownership stakes so that academic researchers, investigative journals can study whether when somebody's in partner with a major for-profit company, does it change the nature of the care in the clinic? And so we think that's really important. So that's the heart and soul of what we're up to.
Thank you. Your last point was going to get to my next question, because I noticed that disclosure was mentioned a few times in the language of the initiative. And so what I'm hearing is that you want to be able to see if the corporate or the for-profit ownership impacts care, which really gets to the heart of this initiative, is about increasing and improving care for dialysis patients.
Yeah, that's right.
And so I want to get to a few questions that people are asking before going to one of my other questions. Is Marilyn asks, why would caregivers be off the floor at any point? Carmen, can you answer that?
Yes. They have to take their breaks. They have to take their lunch hour.
Mm-hmm.
And, sometimes they have to use the bathroom facilities.
Mm-hmm. Gotcha. And similarly, how someone asks, how frequent are bleed outs or other incidents in the clinics?
Well, pretty much daily. You know, like I said, everybody has different health issues, and, you know, whatever they're going through, if they're having clots in their fistula, or if they're just, you know, bleeders. Mostly it's due to, you know, fistula clotting, infiltration. It's just, I don't know. Did that answer the question?
Yeah. And David, do you want to add?
Yeah. I mean, when we studied a group of clinics and we pulled all the 911 records, and about 3 times a month, the clinic gets overwhelmed by a medical situation, has to call 911. So some regularity of pretty significant medical events happening inside the clinics.
Gotcha. And then, so why do you believe, I'll start with you, David. Why do you believe people are against having a physician or a nurse practitioner or a physician assistant on site?
Yeah, I think people have been misled. I think they're being led into a false choice that, you know, clinics might close if you put a physician in the clinic, and it's just not true. That's why we regulate the closure. So, you know, we think people probably are being presented a false choice. And so this industry spends billions of dollars on share buybacks for shareholders and in dividends to holders. There's a significant amount of money. There's enough money to fix the quality of care problems. And that would start with putting a physician or an advanced medical practitioner into the clinic. And California is actually behind on this. I mean, Texas, Georgia, Louisiana all have state mandated staffing for dialysis clinics. You know, so this is just a first step, and it's a relatively modest step.
And I do see we do have a number of people in the room who are either on dialysis or who care for people who are on dialysis. So thank you all for being here, and I'm sure they might be able to share their insight as well if they would like in the chat conversation. I want to ask a question from the audience to kind of go along with the last point. There's a question about, what about the argument that the dialysis center will go bankrupt if Prop 29 passes?
Yeah, again, we think that's not true. 75% of this industry is dominated by 2 very large for-profit companies that have enormous economic power. They're, you know, like a cost of a dialysis treatment is, you know, $300, and they're able to secure $1,000 payments from insurance companies. There's no lack of resources. And then if they were to get into financial trouble, that's where we have the Department of Health oversight and trying to figure out how to help the clinic, or maybe another operator should run the clinic. So we think there's plenty of safety.
Gotcha. So that's a very great point you raised. So the requirement to notify a possible closure is not just a perfunctory thing to say we're going to close. It's really for that way the state can intervene and be able to help to make sure that clinic stays open. Is that what I'm hearing?
Yeah, and that happens in other parts of the healthcare sector too, right? You don't want a hospital suddenly closing and going out of service, or even nursing homes. You know, that this is not uncommon to make sure that, you know, when a healthcare provider who's critical gets into trouble, that there's some oversight, right? So patients aren't hurt and transition of care is established.
Right. I remember when the bank crisis happened several years ago, I used to be a customer of Washington Mutual, and Washington Mutual closed, and the next day it was Chase. So they do it in banking. Why can't it be done and with these clinics? Carmen, I would love for you to share briefly, as a patient, what do you think what would the impact be to you personally or to other patients you know if the clinic that you went to closed all of a sudden?
Well, you know, dialysis is a life-saving technique. So if it closes and we're not able to treat, we run the chance of dying. I don't believe that my clinic will close because I'm from Walnut Creek in the Bay Area. So I'm sure that the doctors that are invested and, you know, all the other people have enough money, or the clinic is making enough money so that that wouldn't be a problem. My opinion of what they're doing is, you know, they're using scare tactics with the threat of closing the dialysis centers and they're portraying a doomsday scenario.
Mhm.
So that really scares people. And that is what they have managed to get across in their advertisements and in commercials and everything else, which is simply not true. As David said, they make enough of a profit. They've got enough money to spend on advertisement and all their little freebies that they give out. And that would more than cover having a physician on staff.
Mhm. And I want to go back to some of the questions people were asking, and it really kind of hits at the main argument of the opposition. So there was a follow-up question about breaks. Wouldn't a physician have to go on breaks too?
Yes, they would. But if they were fully staffed, then we wouldn't have a shortage on the floor. The problem is that they are not fully staffed. There is always a shortage. And that is where the problem comes in. So yes, a physician would need a break, but if they're fully staffed, then we wouldn't have any, safety issues on the floor.
Gotcha. And then, and someone asked, are there at least 2 caregivers present so that at any given time, or is that only when they're fully staffed where that situation exists?
In my particular clinic, 2 technicians is short-staffed. We have 3 pods. So that means the other 2 technicians are having to run back and forth between their pods and the third pod to take care of the patients. And when we only have 1 nurse, again, she's in charge of all the patients.
Mm-hmm.
So 2 technicians, 1 nurse to 12 to 15 patients is just not healthy or safe for us.
That's very clear. I have a question for you, David. Who besides, or who in addition to the California Democratic Party is also supporting Prop 29?
Yeah, I mean, I think the other big support we have is the labor community. We have the endorsement of the Cal Fed, which is incredibly important. It's the whole weight of the labor movement. And then we also have a number of community groups that we're working with who are out doing healthcare in the community who are looking to support us as well.
And who's on the other side?
I mean, all the money, not all the money, most of the money is coming from Fresenius and DaVita and in other for-profit dialysis centers. So the significant contributors are publicly traded companies. In the case of DaVita, it's owned by at least one of the richest men in the world owns a significant part of the company. So very, very rich, well-pocketed opponents.
Very helpful. So, so California voters have been asked this question twice before, I believe. How is this proposition different than those prior 2 attempts?
Sure. So I think it's important to remember that DaVita in particular helped really disrupt the Obamacare exchanges. They played around with a lot of the risk pools and had really angered Democrats in the state as well as across the country. So the first proposition really was about price regulation and making sure that Fresenius and DaVita couldn't gouge the Obama exchanges as well as commercially insured folks. So the first proposition actually was all about fighting back the harm that they had done to the Obamacare exchanges. And then the second one was then we shifted onto patient care issues because we had a bunch of worker supporters and patient supporters who really wanted to tackle the severe quality of care issues in the industry. So that was what we did the last cycle. And then this cycle, we improved it. We listened to the opposition. The opposition said they didn't think there was enough doctors. So we added nurse practitioners, physician assistants. The other side said they wanted to see more experience in end-stage renal disease before somebody could come into the clinic. So we added a 6-month requirement. We also heard from academic researchers and investigative journals who wanted to understand these ownership structures and wanted to see if it impacted care. So we added that. So we've improved the ballot measure. We heard the criticism from the other side and we moved towards them. And so we think we have an even stronger ballot now.
Very helpful. Some other questions from the audience. What is fully staffed, not including a doctor?
Okay. I don't know if David wants to answer that, but I will tell you, fully staffed means that you have enough technicians to take care of at least 4 to 5 patients per session. At least, no, a minimum of 2 nurses to take care of the patients. I'm going to tell you that in my center, I have repeatedly questioned and asked for, a solution to the short staffing. I was ignored so much that I was finally compelled to file a formal complaint. So when they took me in to talk to me about my complaint, I pointed out why I felt it was a safety issue, only having 1 nurse and 2 techs. And they pretty much just gave me a lot of platitudes and, excuses and promises to change things and everything. But I was also told that it is not a safety issue for the patients to have 1 nurse taking care of 12 to 15 patients, which that's not, I'm sorry. I'm living it. I'm there. I'm scared. It's hard enough having to go to dialysis 3 times a week, but not knowing what to expect and being anxious on the chair, that's detrimental to our health. I'm sorry. I don't need any added extra stress or any, extra concerns, because they don't think that we matter. And we do. This is our life that they have in our hands. So if they're not staffing and they're not making sure that we're safe, then it's going to cost somebody's life if it hasn't already. I'm sorry.
No, thank you, Carmen, for sharing your story. David, you wanted to add?
Oh, yeah. I was just going to say other states have said that, for every 3 patients, there should be 1 staff person on the floor like that, like other states have tackled this, not just Democratic states, red states have tackled this. This is really not a controversial issue, except for all the money that the other side is spending.
Yeah, no, it definitely is an issue that is confusing. I think for people who, to voters who are not on dialysis or who are not supporting loved ones who are, the issue might seem very complicated. But what I'm taking away from this conversation is that it's pretty clear that the staffing issue and the having a medical professional on staff to be able to assist in an emergency will help to increase patient care for people who are on dialysis. Is that how? Am I hearing you correctly about when it gets down to the bottom line?
Yes. That's it. It's all about, patient safety, patient care. DaVita has done away with their mission and value statements, and it has come down to profit over patient safety and care. And pretty much that's all that they seem to care about lately. And it's pretty devastating to know that the money is more important to them. Profits is more important than whether we live or die, because that's what it comes down to.
And a follow-up question a question from the audience is, so what happens if there are adequate numbers of doctors or nurse practitioners? Like, what do you see? I think first you, Carmen, how do you see that will benefit? Can you give the audience a clear sense of how you see that will benefit your care?
Okay, I will give you a perfect example of, when people pass out, you can die. You go unconscious. So having a medical doctor on staff, to attend to that, would definitely prevent somebody from having to go to the hospital and dying, either in the chair, because that has happened, or dying by the time they get to the hospital. Mm-hmm. Same thing when we bleed out, ruptured fistula, things happen when we're on the chair. People have a lot of medical conditions that are affected while you're being treated. as you're being treated, you're putting some pressure on your heart. Having your blood pumped out and then having it put back in. I mean, that's a lot of stress that you put your body through. So different things can happen. So it is important to have a physician on staff because you don't want somebody dying. You don't want somebody having to go to the hospital from complications. You can get infected, from being treated on the machine. So there's a lot of complicated medical issues that having a doctor on staff would not only help prevent, but would save a life.
Carmen, you are the best spokesperson for initiative I've heard in a while. I think you're like,
thank you.
You're helping me to understand it very clearly. I'm sure the audience as well.
Thank you.
A last question, what if a clinic can't find the nurses or doctors to staff? Will they have to close, or what happens to them in those situations?
No, the ballot measure has safety precautions around that. So the Department of Public Health can declare a shortage of practitioners and allow a telehealth option so that they can get in touch with a physician or a nurse practitioner via telehealth. So we have a backup plan.
Great. So it's almost like hospitals have to have doctors and nurses, and we have a nursing shortage, but we find a way to function. So what I'm hearing is that the initiative has a similar fail-safe in there, where we want to improve the care of people who are getting dialysis, but not to the point where it's not realizing that the reality of the situation, that there might be a shortage, but you have a way to deal with that.
Yeah, that really comes up in the rural areas. Like if you have a very distant rural clinic, that may need to use a telehealth option. But we think in urban areas, because we've added tens of thousands of people that the clinics can hire, we don't think there should be shortages, except in areas that are already in extreme shortage.
So in closing, if someone wants to learn more or to support the initiative financially or volunteer-wise, how can they do so?
I think they dropped the website in the chat, so you can click on that and it'll have how to get involved and where we stand on all our issues.
All right. Well, Carmen, I want to thank you for your time and for your insight and for being so open and honest with the audience. I think you help a lot of people to really understand what this means in real terms. And David, thank you for your insight and being able to help us understand why this initiative is so important and what it does. And to everyone, thank you all for being here, for joining us for this prop talk. The video will be available in the next few days. You can share it with friends. You can watch it again if you want to re-educate yourself on an issue. The past prop talks are also available on our YouTube page. The link is in the chat. We have one next week at the same time, and there should be a slide coming up in a second to let you know about that one. But thank you all for joining us. Thank you, Carmen. Thank you, David. Remember, vote yes on 29. You should already have your ballots. I got mine today.
Yes, I got mine today.
Yeah, me too. Well, thank you for hosting.
And let's thank Shelly, our captioner, and Tony, Shelly, our ASL interpreter, and Tony, our captioner. My apologies. Thank you all.